So the nerve that innervates the serratus anterior is the long thoracic nerve. The long thoracic nerve comes off of the brachial plexus. C5, C6, C7, right? So C5, C6, C7. Those three nerve roots come together, form that nerve, and it comes down around your neck into the anterior neck here between the scalenes, and then it actually dives underneath your clavicle. As it dives underneath your clavicle, goes underneath your pec as well, and comes out into the armpit, about mid-axillary line, and then comes down the thoracic cage to the finger extensions of the serratus anterior. It's a very, very thin and superficial nerve right here, okay? Sometimes you can even feel that tenderness in that spot. That tenderness is oftentimes people think is a tight muscle. Really, it's the nerve. It's very high sensitivity, especially when it's not gliding very well. So we're going to do 3 things to free up that space. First, we're gonna actually treat the clavicle. Getting clavicle mobility is so important for the function of the serratus anterior, among other things. The way we're gonna do that is self-massage with the Franklin ball or the Corgus ball along the inferior border of the clavicle, starting at the SC joint, working your way out to the tip of the shoulder. You can either come in a diagonal and do kind of the whole pec area if you'd like. And then we're gonna take the Corgus ball and do the neck, like make out with the Corgus ball to get above the clavicle. The other way, especially if you're a clinician, you're working on your athlete, you can use a cup. I love a cup in this area to do a skin lift technique over the clavicle as well. I'll do the entire length of the clavicle, inferior right on top of it, and then superior all within this anterior triangle here. And then also you can do it with movement. So I'll have the athlete, or I'll use my hand and I'll put it on the SC joint, and I'll ask them to raise the tip of their shoulder up by thinking about it being a teeter-totter. So as the shoulder tip rises up, this SC joint goes down, and they'll feel that motion almost as if this going down motion is what takes the tip of the shoulder up. We'll do a few of those, how they can feel it. I'll even do like a light skin rub as we do that direction. And then we'll go posterior and anterior with it too. So as the SC joint pulls away, the tip of the shoulder comes forward, that's protraction of the scapula, and then the SC joint pushes out, that's retraction. The focus though is on feeling the movement of the SI joint and freeing up the clavicle. Okay. Next, we're going to take the Franklin ball and we're going to go into that space underneath the armpit and do a little work there.